Medical disclaimer. I am not a medical doctor, nor do I have any formal medical training. All content found in this video, for example, text, images, audio, figures, etc., is for informational purposes only. This video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard, seen, or read about in this video.
All right, so let's first examine the setup. So at one end of the couch, I have a triangle wedge pillow. This is a wedge pillow that people use to sleep on in bed if they have GERD. I don't know the height of this wedge pillow, but it's pretty tall. And then on top of it, I have two pillows. So this is a setup that I use for doing injections into my thigh and injections into my abdomen. If I'm doing a deltoid injection, I remove this top pillow, and that's the setup that I use for the deltoid. And I'll show you in more detail kind of how I use this setup. All right, so for a thigh injection, what I would do is I would lay on my side and I would have my legs kind of bent up almost in the fetal position. Make sure the thighs are nice and relaxed. Here I'd be injecting onto the top thigh because I do not have access to the outer part of the lower thigh. So here what I would do is I would have my injection site marked off. I would have my syringe ready to go. And then I would pinch and then push the injection in and administer my injection, and then I'm all done. And you can see here that I don't have to do any movement, I don't have to crunch, I don't have to do any of that. Because I've elevated myself so high, I can easily access the injection site. And my leg is nice and loose, so I won't accidentally tense the muscle while I'm doing the injection. To access the abdomen, the same thing. So because I'm lying on my right side, I can really only access the left-hand side of my abdomen. And so here again, I can easily inject into my abdomen laying down. A 45-degree angle would be a little bit tougher in this position. I'd probably have to go in with my left hand. If I wanted to inject on this side, I mean, I could do it this way, but it'd be a little bit tricky. You can also turn yourself on your back, put your legs out flat, and then again, you can easily access the abdominal area to give yourself an injection while laying down. Now, if you're on the thinner side, this particular position may not work for you because you need to scrunch up a bit to get enough fat to do the injection. But to do that, you can bring your knees up and put maybe a little bit something behind your head so that you're elevated even further, and then you've got more fat to inject into. And then for a deltoid injection, I remove this pillow. And kind of get your arm over the side of this pillow that you're laying on, and then do your injection this way. Now, if you're on the more flexible side, so I have some flexibility in my arms, I can actually reach this hand up and pinch and inject. You can do it that way as well, but it's just easiest just to do it kind of over the edge of the pillow, your arm nice and relaxed, and then just go into the deltoid area and then give yourself the shot. I hope this video was helpful in illustrating to you on how to give injections in the deltoid, abdominal area, and the thighs, all laying down. This is very useful for beginners or for people that have a needle phobia or are afraid that they're going to get lightheaded or faint after the injection. This way, you're safely supported when you're doing the injection in case something should happen. When I first started doing my injections, after I did the injection lying down in this position, I would remain lying in this position for several minutes, sometimes up to an hour afterwards. I would play like Zelda Breath of the Wild or some other video game and just kind of relax until my body kind of chilled out a little bit. So I hope this video was helpful, and I hope you have a successful injection. Bye!